Hi, my name is Tara. I'm a nurse practitioner, a CRNP with Faith Care. So I just wanted to give a little background of what the flow is like on any given clinic day. New patient paperwork is reviewed, and if they need assistance, the paperwork is reviewed with an interpreter. Our nurses will take the patients back to any one of the rooms and begin the rooming process just as if you would if you were in an outpatient clinic setting. They will also do baseline finger sticks to include glucose and cholesterol, especially if it's a new patient. Once that's completed, the chart is brought back to the main registration area and left, and they notify one of the providers that the patient is ready to be seen. Once the provider is ready to go in and see the patient, again, just like you would in any outpatient setting, where there is typically one of our physicians or myself, as well as an interpreter, and typically a nurse is there as well on standby just to help with whatever may be needed. During the visit, a physician or myself may pray with the patient, especially if we are a spiritual counselor, a spiritual care provider, as well as the medical provider. However, we do have a spiritual care provider that's always on hand that is able to pray with the patients and ask any questions to the patient to help them grow in their faith, or just available for patients to ask questions if they have any questions themselves. So we always do have a spiritual counselor on hand and available with a nice private area for the spiritual care counselor to speak with the patients so that they do feel comfortable doing that. During clinic sessions, we may have a specialty there. For example, we do have OBGYN that is routinely there. We have family practice through some physicians as well as myself. We also have ophthalmology that comes regularly to help perform eye care for patients. And we do have some pediatrics physicians that will come and volunteer as well. Our goal is to grow the specialists that come in to provide care to patients in the future, but those are the current specialists that we have.